Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, George, tell me what's going on with your knee, your foot, the left knee and foot.
Okay, in December of 2017, I had a knee surgery that was very invasive, where they had to remove my ACL ligament.
And this knee?
And this knee, yeah. The reason they had to remove the ACL ligament is in 2010, a surgeon did an ACL reconstruction and put the cadaver in wrong. He drilled the holes in the bone wrong. So 2 MRIs.
2010, you said?
2010, yeah.
Oh, wow.
And I had problems with it ever since. So in 2017, I went to another orthopedic surgeon, the surgeons for the Indianapolis Colts. And they did 2 MRIs, and 2 different radiologists said that the cadaver, the ACL, was in wrong. So they removed it. So since they removed it, I'm walking better. I don't have an ACL, but I've had nerve damage, and my IT band is very tight all the way down. And then the top of my foot, it hurts really bad, and then the bottom of my foot.
So how much pain do you feel there from 0 to 10, and where do you feel it?
I feel it on the top of my foot, all up way up into my ankle, and then through my toes, and it's constant 24 hours a day, like a 5. And there's times when it's an 8. Well, when I was able, about a month after, when I was able to get through the pain in my knee, I could start feeling, the nerve damage from the surgery.
What kind of pain? Sharp, dull, aching, tingling?
Aching in the middle of the night, and aching so bad it will wake me up. And then there's definitely tingling, and then numbness.
Numbness, and all that's most of your pain concentrated on the top of your foot.
The top of my foot, and then inside the ball, inside this area.
In that area.
And I've tried stretching it, rolling it, ceramic wheels.
Oh wow.
Yeah.
Okay, don't do that at home. Yeah.
Like plantar fasciitis tools I've tried to do.
You try that. Yeah. So December, we currently in October 2018, so it's about like 10 months or 11 months. So what type of treatment you had before coming here?
I've had chiropractic, where they said something was out in my hips. Caused my foot pain.
Okay.
So they tried to straighten out my hips. Okay. Then I had massage therapy from numerous different massage therapists on my feet and my ankles. And one said it's because my shins were so tight, and that the IT band was causing that tightness down there. So they would work in it with their fingers and really dig in really hard. So
you had chiropractor, you had massage. What else? You had physical therapy?
Not on the foot. Haven't. Okay. Yeah. They said it would go away after time on its own. So they didn't give me physical therapy on the foot itself. Okay. I had physical therapy on the knee
after the surgery.
Yeah, but that didn't help my foot.
Okay. So can you give me a little bit like what's going on with your knee now? How much pain? What's difficult for you to do?
Okay. So this is counterintuitive, but without the ACL, I'm able to move my knee, and I've been able to ride my bike and jog and run, but very carefully, because I don't have an ACL ligament. Okay. So I've got range of motion, and I don't have much pain in it, but my leg has gone out on me where I was going downhill.
Like gave out, yep.
It gave out, and I fell down one time in the landscaping,
and
I
gotta
tore
be
it all
careful.
up.
Yeah, okay.
Because I don't have an ACL, so I'm dealing with that. But mostly, the IT band that goes up to my hip is what's causing. It's like a rod in my leg, and you can feel it.
And that's since 2017 or since before that you have. Okay.
Yeah.
So you feel tightness in your IT band.
Yeah.
Okay. All right. Any other treatment you had? Anything else we need to know about this?
Just pain pills. I went to a pain clinic.
Okay.
For
so
pain
management. Okay.
That did not work for me.
So I want to know, like, I know you told me you have like a constant pain, like how much, 5 to 6 or something like that?
My foot, like
your foot.
Yeah,
okay.
It's a constant 24 hours a day.
24 hours.
Oh yeah.
I want to do a motion that actually stimulates your pain. To use that for testing. I know
Okay.
you have pain currently, but I want to see that motion so when we do the treatment we can retest it again.
Okay.
So what aggravates your symptoms? Standing, walking.
Standing.
Okay.
But walking. Every time I bend my foot up like this to take another step.
Mm-hmm.
So when I take a step and my foot goes up, I feel it. I feel it right in here.
Okay.
So I take a step here and then right there.
How much from 0 to 10?
It's 6, 7,
Okay.
8.
Okay.
And
So
9,
when you do like heel raises.
and I don't because they hurt like right there. I'm on one foot, but if I do one, yeah, it's I can do it, but I'm about to grit my teeth.
Okay. How much from 0 to 10?
It goes up to a 9.
Okay. One more time. I want to see how much pain and give me the number.
Okay, so let's just 6 and 7.
Okay.
Wait,
Don't fall. Okay.
8, 9 and a half. Yeah.
Okay, don't push it. Okay. All right. So it's just a few seconds, and you feel that. So we're gonna use that for testing. Okay.
And then when I go downstairs, anytime there's impact like this, I'm not hitting it, but that tap.
Tapping like that.
So just tap like that, tap. It's pain. It goes up, shoots up my leg, and it starts going numb. Just tapping.
That tapping.
And I'm barely touching. I'm just tapping.
Oh, okay. Numbness. How much from 0 to 10?
That goes up to about 7, 8.
So we're gonna use that tapping, and we're gonna use the hair raises to see how you respond to the treatment.
Yeah.
All right. So you have problems sleeping with
Yes.
with all of that pain. Sorry about that. Okay. So make sure what I'm doing. So it's not painful. When you say the pain here, where is exactly?
It's inside it. There's like knots.
So you feel your pain, like the whole area here in the plantar area?
Some, yeah.
Where's the worst point?
Like inside here.
That's the spot.
And there. There's. Yeah, like.
Okay.
And there, feels like there's knots inside there.
Yeah, I can feel that. So you have plantar fasciitis and you have this numbness from the. So worse your pain is
right there.
Okay. Is that painful?
You found something there. Yeah.
Okay. If your pain is not increasing from the current level, that's fine.
Okay.
If it's increasing, make sure you let me know. Okay?
Yeah.
Is that increasing when I do this?
Yeah, right there, big time. Yeah.
Big time. Okay.
Yeah, it went from like a 5 to an 8.
Okay.
But it's like there's like a knot in there.
Yeah, I feel a knot and a bend, both.
Yeah.
Okay, what about when I do this?
No, I don't feel any pain.
Okay.
And then, I try to, we live on the lake, so I tried to walk barefoot, and it hurts too bad to even just walk on steps and the pier.
I don't think it's a good idea to do that.
It's like the bottom of the lake, like at the sandbar, I can't walk on the bottom of the lake without having shoes on.
Yeah, well, you have a kind of flat feet, so you need to really have arch support.
Okay.
So that's probably a risk factor for plantar fasciitis. You know, is that too much?
No. Surprising, it does not hurt.
Yeah. Because, okay. I'm gonna go deeper, but I'm just.
I don't feel any hurt there. That one spot was bad, but those two spots are not hurting me.
Okay.
No pain.
Okay, that's good.
Pressure. It doesn't hurt though.
Okay. Okay.
And I have the same problem in both feet, but this one's worse.
Yeah, the left side.
Yeah, I think it's because of the surgery on my knee and just.
Okay. All right. So let me know if this is too much now. Okay. Yeah, you feel that bend? Yeah, it's right in here. Let me do this one here. Okay. Is that too much?
Right there it is.
No, sorry. What about now?
No, that's okay.
Okay.
So there's bands in the foot too?
Well, when you have fascia restrictions
Okay.
along the muscle, along the soft tissue, sometimes it feels like band. You know.
And that's
because
pain right there.
Sorry. Okay, you're not tolerating this. Okay, so I'm gonna do something else. So yeah, that sometimes is a band feeling because fascia is wrapping the, especially on this area like the premiycin or endomycin, that or the fascia wrapping this area, it's get tight, and it's similar to like wearing a t-shirt too tight.
Oh, okay.
2 to 3 size smaller, so it's just gonna do this.
Oh, okay.
You know.
Yeah.
Because you don't have enough room for things to move freely. So that's usually what is the band feeling. So
and of course that's all really tight.
Yeah, let's pull your shorts up.
Pull them up?
Yeah, pull up this side. Okay. Yeah, your IT band is really tight.
I know, I hear it from
Is that too much?
massage people tell me.
Yeah.
No, I don't know what you're doing, but it's okay.
Okay. Wow, you feel this band?
Well, yeah, absolutely.
Make sure it's not painful, okay?
Well, it's just painful all by itself.
Oh, okay, I mean like, make sure what I'm doing is not increasing the pain.
There's a huge knot or something.
Yes, and you can see my hand here, it's like rolling over the band and the scar tissue.
Yeah, I feel it.
Like here, you see that?
Yeah.
And instead of like going here, I'm actually applying the same pressure. This is going deep in. This is
there's
rolling over.
Big problems in there.
Okay. How's that? Too much? Relax.
I'm trying. Okay, I'm trying.
Is that too much or it's okay?
I'm working with it.
Make sure it's not increasing your pain level.
Yeah, right there.
Is it increasing?
Yeah.
Okay, we're gonna do something else.
They've been tight for a long time, over 20 years.
Okay. How's that?
I can live with that.
No. As long as it's...
Hurts pretty good though.
Okay, sorry. Okay. Let me do a couple of other things that you really have some inflammation there. And a lot of tightness. Is that too much what I'm doing?
No.
Mm-hmm.
You know, I was probably wrong at 20 years. It's probably been that tight for 30 plus years.
Yeah.
And I've just dealt with it. I've done a lot of bike riding, and we do these 100K rides, and I, get to the end of those, and my legs are just shot, fried, and
is that painful? It's okay.
It's some pain.
Sorry.
That's pretty painful.
Sorry.
That's okay there.
Okay. I have some work to do here as well, Georgia.
Yeah, I gave you quite a challenge today.
That's okay. You're keeping me busy.
I hope you're up for a challenge.
Yeah. So can you tell me a little bit more about the shin splint that you have? What's going on?
Yeah, so I started getting shin splints in high school when I was running, and seemed like the only way I could lose weight was by running. So I would go out and push myself.
You can lose weight with nutrition. We're gonna go over this after the video.
Then I started, riding bikes was good and swimming, but then I'd ride bikes for a long time and going up hills. My legs, my shins would fry and hurt, and I'd rub them. But I kept riding my bike as it's good exercise, and then just standing all the time, doing heating, air conditioning, and standing on concrete and working on ladders and attics. My legs never get a break.
So currently you have the same issue. Like how often you get the symptoms in the front?
On my leg? 24 hours a day.
So this is constant.
It's constant.
This is constant.
Yeah, I just deal with it. I mean, it just.
You have a high pain tolerance.
You know, it's not that I haven't tried to get therapy. I've had, you know, therapy and massage therapy for years, weekly, 2 to 3 times a week. And they always work on my legs, and they say, "Oh, your legs are so tight."
How long do you do the massage therapy?
I have 2-hour sessions, like twice a week.
For how long you been doing that?
Sheesh, 10+ years. No one's ever worked with the scar tissue.
It's hard to break it with hand. That's the reality.
I heard a couple of the ladies said you got scar tissue, but they didn't know how to deal with it.
Well, with hand you cannot break it.
Oh, well, they tried to with their thumbs.
Well, I feel bad for them because they're gonna have issues with
Oh,
their
they
thumbs.
were hurting when they get done with me.
It's like, okay, do you help the patient and hurt yourself? So you need someone
That's
to
what
treat
they
you?
said. They said I got to get a massage. Oh,
Oh, sorry.
but no, it's just it's sensitive. They're really
Sensitive?
The bottom of my feet are so
Okay.
sensitive.
I usually don't do this, but because of the camera, I just
Yeah.
standing by the side.
So that's a tight area.
You feel
there.
this band?
I
There's
feel
not
it.
here.
Yeah, I feel that.
Yeah, you have some inflammation there. You feel how nice and smooth here?
Is it? Okay.
Nothing.
Yeah. So
Yeah.
I thought that
Compared to this.
Oh gosh, that's all rocky.
Yes. You see the difference between the left and right?
Oh gosh, it's like speed bumps in there.
Yeah, and it's a big knot here. You see. Actually, the tools you can see it's bumpy here.
Yeah, I'm trying to loosen it for you, but
No, it's hard.
the bottom of the feet are just gonna have to move really slow because they're so sensitive. They're like ticklish, but it hurts.
Don't kick me, okay?
No, I try not to.
What about when I do this? Too much?
No, I'm trying.
Ticklish or sensitive?
It's ticklish.
Okay. Is it ticklish here too? Oh, you are ticklish.
Oh, it's
okay.
bad. They're so
Okay.
sensitive. You can call me tenderfoot.
Okay, is it too much?
It's not too
It's
bad.
too
You go
much?
slow, it would help.
Okay, what about now?
Yeah, that's not too bad.
Okay. So it's ticklish, not sensitive, or both?
It's both, yeah.
Is it painful when I do this?
No, it's not painful. It's just so ticklish.
Mm-hmm. Well, it's fun to be here.
I guess so.
I had patient that it was very ticklish. You can, like, he was laughing all the treatment.
Oh gosh, we'd have to about seatbelt my leg down.
Yeah. So it was really enjoyable treatment. It was fun. Too much?
It's something, I'll tell you.
Okay. Well, I'm not able to do a lot of work here, so let me try a couple of other things. Gonna try different things with you, so to desensitize this.
Oh, that'd be wonderful. It's even sensitive with the towel.
Yeah, I know. Yeah, your nerve ending is very sensitive here. So
Yeah, they are.
I'm gonna do some desensitization here.
I'd love it.
Okay, is it too much?
No?
Too much?
Getting close, but not
Okay.
bad. Yeah, I don't like that they're sensitive at all. I do not like it.
Well, you have a lot of scar tissue that,
When I try to
and
walk
fascia
around,
restrictions
you know,
that compressing on the nerve ending,
Mm.
so it's just make it fires a lot.
oh, it is.
So
When I try to
that's-
walk barefoot, even in the house or
No,
going
I will
down the
not do
steps, man, it
barefoot.
hurts.
I don't think it's a good idea. You're gonna make it worse.
Oh, heck yeah, I heard.
Make sure you wear shoes,
Okay,
orthotic, something comfortable and cushiony.
okay,
I will go over the type of good shoes with you after this.
okay.
But looking at your feet anatomy, I don't think it's a good idea to do barefoot.
Okay.
No. So this is where you had this. Wow, man, the 2 surgeries, yeah.
Well, one, but the other marks is the one right here. This is my surgery. My leg gave out about a month ago when I was in the landscaping going down the hill
Mm-hmm.
because my ligaments gone and I wiped out, and this is all tore up from landscaping rocks. But
Oh,
that's the
is
surgery.
that scar from the landscaping?
Yeah.
Man.
Oh, it tore me up. I went down and rolled down these sharp rocks. They cut me open. I bled everywhere.
Wow.
So this is the surgery, but yeah, this was bad, and that's when I knew I needed my ligament.
Another arthroscopic, man.
Yeah.
So why they did L shape here? Not
because they had to go in and remove the screws and the cadaver. So everything was done arthroscopically before, but to take all the equipment out, they had to cut me open. Yeah, it was bad too. But I was just going down the landscaping, and without ligament, my leg gave out, and so I crashed down in the rocks.
Wow, that's rough.
Yeah.
Is that too much what I'm doing? It's okay.
No, just it tinkles in there.
As long as it's not aggravating or something, that's fine. You can.
Yeah, my wife said I was very graceful when I went down in the rocks.
Yeah. she watched you? Okay.
Oh, she saw the whole thing.
Oh
yeah.
my gosh. Did you have it in the video?
I wish we had on video.
Oh, man.
My neighbors saw it and everything. They're all like, "Are you okay?" Like, yep. I was gritting my teeth and bleeding and rocks.
Did you hit your head?
No, I just went straight down and it just dug down in the rocks. So then I got up, finished what I was doing.
Oh, you did?
I did because I was proud.
That's too much.
Too much pride. So I went in, took a shower, and started digging all the rocks out of the washer.
Ooh.
This is bad. That's when I knew I have to get that ligament put back in the leg at some point.
Wow. You're really tough on your body.
Oh, you're not kidding.
That's, yeah. I definitely don't recommend you do that again. Just listen to your body. When you have something like this, you feel pain or you hit yourself or fail or something like that, totally stop.
I agree.
You need to
I recommend you not fall down in the landscape either.
Yeah, don't recommend falling actually. Man, and you said this in here, yeah?
Yeah.
Okay.
That's a good area right there too, yeah.
Okay.
Right where your thumb is in your hand. All that is just tingly, numb,
And you start to feel that after the surgery, yeah?
Yeah. They said there would be some stuff
nerve
like that
damage.
because of nerve damage and.
Okay, we'll know today if
right
actually nerve damage or soft tissue restriction
Okay.
that compress on the nerve.
Okay.
Okay,
Yeah.
based on your response to the treatment today.
Okay.
So hopefully it's not a nerve damage.
I hope
Because
not.
if it's a fascia or scar tissue compressing on the nerve,
Okay.
with releasing those tightness, that should decrease the pressure on the nerve and hopefully that numbness and tingling disappear. So how to know which one? Just a process of elimination.
Have you had anybody with this problem before?
Yeah, I had a lot of patients with numbness and tingling.
Oh.
That's
Okay.
a common thing I see frequently. Hello.
Take care.
Okay. So, yeah, that's a common thing. And actually, it's overlooked that the numbness and the tingling could be from scar tissue or fascia restrictions.
Oh.
And a lot of the time misdiagnosed with nerve damage in the back or, sciatica or whatever. It's depend on what the distribution of the nerve. But I prefer to do the process of elimination and just go through the nerve distribution and release it and see how the patient responds.
Okay.
Is that too much or it's okay?
Yeah, I can. That up there is the most sensitive up there. That in there is just.
I'm not surprised with your
tingling and pain, but.
Is that what I'm doing aggravated or no?
No, just right in here. That. Right in that area, it's tingly.
How much?
It's like 7 or 8. Yeah.
What I'm doing.
That doesn't hurt too bad though. Yeah. But sometimes, not. It just feels like it's on fire sometimes.
show you too. Yeah, the tightness of IT band, you can see the band. You see the tightness.
Yeah, I'm a massage therapist.
You visually can see. You see the lines. That's how bad his tightness is. You know, it usually should not be.
Normally can't see that, huh?
What?
Normally can't see that.
Yeah, not that bad. You know, you can see the dent here. See that? That's from it's pulling. It's like, you know, you have a rubber band and you pull it.
That's what it feels like.
You see the tension.
Yeah,
you know.
That's what it feels like. Yeah.
That's a very tight IT band. Compared to this side, that's tight too.
I know, they're both tight, but this one's the worst.
Yeah. And we're gonna see how you're doing with breaking the scar tissue in that area. Okay, so let's see if you can tolerate that. You definitely have a lot of inflammation here. That's why I'm not able to do a lot of work here.
Yeah, I know.
Okay, so we're gonna do other stuff on that area, but I just wanna release this and see how you respond to the treatment. Okay, so gonna. Is that painful?
No.
Relax, relax. Sure, I'm gonna get it everywhere. Relax, relax, relax. I want you to relax, relax. Don't worry, yeah.
That's the hardest time is relax with my legs. That's because they're so tight. I try.
You hear that?
Gosh, I can hear it clear up here.
I can hear it very loud.
Yeah.
And where I work on it, you can hear the sound and you can see the redness of the scar tissue. Of course, you can feel the rumbling, and I feel it with the tools.
I feel it clear up to my brain.
Yeah. Well, the good thing about ASTR tools, you can hear the sound. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.